Howdy folks, it has been a few weeks, I believe, from our last clip, talking about being a hospitalist or hospital medicine. I have been fairly busy over the past few weeks doing random stuff, but now you have my full attention and I finally have some time to go over some of the things that I like or dislike about being a hospitalist. Before we start, I do think that my hair looks like a mess, so I do apologize, but I think it's okay. I was never known for my good look, good hair, and and those were jokes, really funny jokes, so laugh. Anyway, for my hair, Mushi is coming with the kiddos to visit me for this Thanksgiving, and I'm sort of looking forward to that. She can finally give me a haircut. I don't think I've mentioned this before, but my soulmate, Mushi, has actually been giving me haircuts since 2009, so more than 10 years at this point. Now that's love and dedication, just like a career in medicine. All right, so today we're gonna be talking about the 3 things I like and the 3 things I don't like about being a hospitalist. Let's go! Howdy folks, this is Dr. Bao. Yeah! The goal of this channel is to make it useful for those of you who might be interested in learning more about a doctor's life. You could be a student, a resident, a fellow, an attending, a parent, or someone who simply loves to information overload yourself.
Seriously.
Although I do work and am affiliated with some hospitals and med school, what I say does not represent the opinion of any entity except myself. Please like or dislike, hopefully not dislike, subscribe, comment, share, and press that bell icon.
Great.
All right, so let's go over the 3 things I like or I love about being a hospitalist. Number 1, the schedule. We have already discussed this briefly over the last clip, but I have to say, I love a hospitalist schedule. Once we are off, we're off. And I mean, we're off. No more pager, no unnecessary email, no phone calls to patients or their families, and I truly have time for my family and whatever I need to do during my off time. As discussed previously, most hospitalists have this 7 on 7 off schedule or some variation of that model. Think about it. What other jobs on earth can give you 7 days off consecutively on a regular basis? It's definitely true that during the 7 on period, we work like dogs or almost like dogs. But having 7, this is how we do 7 in Taiwan. Again, Americans, we do this. I think it's a little bit more complicated, but Taiwanese folks, we do 7 as this. Anyway, so having 7 consecutive days off means honestly a vacation that can be at least out of town, if not out of the country, which is great. And you can honestly do this every other week or after your 7 days on. So I think it's a great perk. Now, some folks might argue that the 7 on 7 off schedule or being a hospitalist means there is no continuity in patient care. And to a certain degree, that might be true, though it is not 100% true in my opinion. Because in every specialty, to a certain degree, there is going to be some pause to patient care at some point, sometimes. So I really don't think this argument is 100% pertinent, though this is somewhat of an argument. So I wanted to put it out here so that you all can decide what is important for you and what is not important for you. Anyway, so this is the first thing I like about being a hospitalist, our schedule. The second thing I love about being a hospitalist is that gratifying feeling or sense of accomplishment when we discharge our patients out of the hospital. You see, because patients that require hospitalization, most of them are fairly sick when we first see them. And I won't lie, sometimes bad things happen, such as patients passing away during hospitalization, which is really sad. But most of the time, under our care, most patients generally get better and eventually get discharged from the hospital. There was quite a few incidences that I remember in which when my patients got discharged, either they or their families came to me and thanked me for taking great care of them while in the hospital. Now, I'm not saying I deserve all the thank yous, because at the end of the day, this was my job. But the sincere appreciation from patients and their families, and the fact that I witnessed the actual clinical improvements in these patients who came in sick, really made my days, no matter how hard these days were. And these feelings truly serve as reminders for myself as to why I chose a career in medicine. So that's number 2, that sense of accomplishment when I witness patients actually getting better under my care. Number 3, money. Now, compared to many other specialties or subspecialties, hospitalists might not make a lot, but I think most of us will say that we are at least well off compared to the general society. Me, personally, and I say this only on my behalf because I know Mushi and most of my family members might not agree with this. But from my perspective, I personally only need enough to get by. I don't need to be super rich. And being a hospitalist pays me way more than I need, though I'm not gonna complain because I do think that extra pay, extra relative to what I need, that extra pay allows me and my family to have a comfortable life, or sometimes more than comfortable, which all of us appreciate very much so. Having said all these, if your aim is to make money, I don't think you should become a hospitalist. Or let's just be honest, I don't think you should become a doctor. Being a hospitalist or a doctor will allow most of us to have a comfortable life. But if your end goal is to make money or be rich, I find it hard to believe that this career will make you happy in the end. So that's number 3. I think the money is fine. All right, now let's talk about the 3 things I don't like about being a hospitalist. Number 1, many times, the hospital medicine service serves as a dumping ground for other specialties or subspecialties. Now, the exact mechanism behind this point depends on where one practices, because different hospitals have different rules or guidelines about what type of patients goes to what type of service. For example, for some hospitals, urology will never admit patients, even patients with purely urological issues without any other concerns. In this case, these patients with only urological issues often get admitted to the hospital medicine service of that particular hospital. And urology will serve as a consulting service on top of the admitting hospital medicine service. And in this particular case, instead of managing true medicine issues, the hospital medicine service simply serves as a babysitting service for this particular hospital's urology service, which in my humble opinion is not only inefficient for this particular hospital's hospital medicine service, but also unfair for that particular patient with only urological issues, because this patient will now get 2 bills, one from the urology service and one from the hospital medicine service. But the real question is, should that patient really be paying for the hospital medicine service? I think this is a very good question for our healthcare system to think about. And what I say over here right now won't change anything at this time. But I think this is a very good point for many to ponder so that our healthcare system has the potential to become more efficient in the future. Now, at some other hospitals, urology might be able to admit its own patients. So this might not be an issue for that particular hospital where urology can admit its own patients. But at most hospitals, there is generally a tendency where when other specialty or subspecialties aren't sure about what else to offer for a particular patient, and that our ED colleagues believe this particular patient cannot go home safely, this particular patient will often end up on a hospital medicine service until he or she is safe to go home. So that's number 1. That hospital medicine is often the dumping ground for some patients due to a variety of reasons. Number 2, or the second thing that I don't like about being a hospitalist, is that sometimes we have to deal with all these non-medicine related social drama. Now, I am sure everyone thinks about medicine or the definition of medicine slightly different in one way or the other. And to me, what I define as medicine, or what I like about medicine, is to find a cause of a problem and to treat it. Not other stuff, some of which I acknowledge to be also very important, but not other stuff such as billing, coding, insurance approval, peer-to-peer review, census distribution, court decision, and some of us might even argue documentation, and perhaps more. Now, I want to emphasize one more time. Some or all of these components are certainly important in their own right, but to a lot of us, hospitalists or doctors to be fair, many of these are annoying or super annoying. So that's that. The second thing I don't like about being a hospitalist. dealing with non-medicine related social drama. The third thing, or the last thing, that I don't like about being a hospitalist is lack of continuity, as we have briefly discussed about previously. For certain patients, especially those with special conditions of interest or those whom I have developed a strong rapport with, sometimes it's really hard for me to not question myself how they're doing after a hospital discharge. For these patients, I do wish there is a way where sometimes I can check in with them to see how they're doing or how their conditions are being managed by their outpatient doctors. But as hospitalists, there's not really a mechanism for us to do that. So there we go. These are the 3 things I like and the 3 things I don't like about being a hospitalist. If you have questions about being a doctor or medicine in general, leave a comment and eventually I'll get back to you. For now, best of luck.